how attractive you find your partner while you're on contraceptives, on hormonal contraceptives, versus while you're not on contraceptives.
Okay.
So you tend to desire your partner more when you're not on any contraceptives. Yeah, because contraceptives are hormonal. They change your hormones, they change your libido, they change so many things. And you actually lose a degree of the desire for sex. Kama amekuwa pull out for 5 years and you're still not pregnant, it could mean one of two things. It could mean he's an expert at pulling out. Yeah. As in hakuna hata like that one chance yenye ame mess. But also it could mean he might be infertile. If you get a vasectomy, you're still going to be ejaculating. Yeah. But that ejaculate will not have sperms because the tube that is now supposed to bring the sperms to the ejaculate has been cut off.
Female health and contraception. So part 3 is contraception. We'll be discussing everything contraception with the lovely Dr. Ndwiga. Yes, so what is contraception / family planning?
Yeah. So contraception, contra means against, and ception means conception, means the beginning of life.
Yes.
So contraception is usually an attempt to prevent a pregnancy, which can be performed on both the males and the females.
Yes.
Yeah. Generally speaking, contraception is divided into two big classes. You have the hormonal contraception and non-hormonal contraception. Hormonal means you use methods which change the hormones to make it unfavorable for the woman to get pregnant.
Yes.
And these will include, number one, you have the everyday pill, which you take every day.
Yes.
Regardless of whether or not you're having sex.
Okay.
Yeah. So if you're on the pill,
it
doesn't matter that your husband is away for a week. You'll still continue taking the pills.
Yes.
Because if you don't, and he comes back and you guys engage, you might get pregnant if you've not been taking the pills.
Oh, so you don't even skip a day?
You don't skip a day.
Yes.
And if by any chance you forget, you can take 2 pills the next day. Although it's not recommendable to like forget, so you could actually just set a reminder on your phone.
Yes.
To remind you of the time you're supposed to take. So you take one every day. Those pills have hormones, progesterone and estrogen, which will make it unfavorable for you to get pregnant.
Okay.
So they're, apart from now the fact that you have to take them every day, they are otherwise very convenient.
Okay.
Yeah, you have those pills. You have the Depo-Provera injection, which is a 3-month injection, which is normally given right here on the deltoid muscle.
Yes.
It works for 12 weeks.
Okay.
It also makes it very unfavorable to get pregnant.
Yes.
And yeah, it has some side effects like excessive bleeding or the complete absence of menses. For women
for the 12 weeks?
Yes, for the 12 weeks, you do not receive any menses, which is perfectly fine.
Yes.
Some women do, but most of them don't.
Okay, and we know like you should have your menses like every month.
Yeah.
So not having them for the 12 weeks, is it bad? Is it, we know you are taking you took the injection because you don't want to get pregnant.
Yeah.
So does it have any effect in your reproductive system?
No, it does not have an effect because after 12 weeks it wears out and you might now receive your menses. Yeah. Although it may take some time for your menses to go back to normal, to how they used to be before the injection. But usually it's perfectly fine if you do not receive your menses because that's just an effect of the injection on your body. Yeah. Because it's hormonal, it changes your hormones, and your hormones are involved in the menses, in your cycle, in ovulation, in menstruating. And if you take an agent that will change the way your hormones operate, then definitely you might experience not getting the menses.
Okay, so the pill and the injection, because they are hormonal, so what they actually do is just try and stop the ovulation from happening. That
yes, they prevent ovulation. Some of them will also prevent implantation. Implantation is whereby after the sperm and the egg have met.
Yes.
They travel to the uterus, to an area of the uterus called the fundus,
Yes.
hapo juu kwa uterus, and they attach there. So some of them will actually prevent implantation,
Okay.
like P2s, which is a very common contraception method.
Yes.
And it's important to note that while it's completely safe to take the emergency pill,
Yes.
it's not meant for a very regular use, because it has a very high concentration of hormone.
Yes.
It ends up changing your cycle, and most practitioners will recommend a maximum of 4 times a year.
Okay.
Yeah.
So, using the P2 regularly, is it true that it can bring about infertility in women?
Well,
Or problem getting pregnant later when you want to?
yeah, too much of P2s will change the way your hormones operate.
Yes.
Yeah. And if you know you're sexually active, you should consider a safer alternative to P2s. As the name suggests, it's an emergency pill.
Okay.
So it's definitely not an emergency if you're taking P2s twice a week, every week.
Yes.
Yeah, it means it's something that you should do something about it. You should look for a better method of contraception.
Yes.
Yeah, because it ends up changing your hormonal profile, and in future,
Yes.
it might actually affect your ability to conceive, because now your hormones are completely altered. Yeah.
Oh, okay.
Your cycle is irregular. You don't know when you're ovulating, and it might take some time for you to like get back to where you are. So too many of those P2s are not advisable. Yeah. So limit yourself to 4 times a year. Yeah. If it's more than 4 times a year, it's not an emergency, and it means you should do something about it.
You're just messy.
Yeah. Yeah. You're just not taking precaution.
Okay. There's also the everyday pill that you said. You find some ladies with the PCOS, they're given some of the pills to use.
Yeah.
Is it safe to use them?
Yeah, those are completely safe. You can also use them to balance your hormones. Okay. If your hormones are misbehaving, if you're having 15 days and then 35 days and then 27 days, yeah, to bring them back in sync, you can take the everyday pill every day for 3 months.
Okay.
To restore your normal balance.
Yes. And it has no effect in their reproductive.
It has no effect.
functioning.
The only effect it has is that you won't get pregnant, because it's also a method of contraception. Yeah.
Okay.
But it will sync your menses, your cycle very perfectly, a perfect 28 days.
Okay.
And you can be able to predict that I'm going to ovulate on the 14th day. I should expect my menses from this day. You're going to to have a very easy time tracking your cycle. Okay. And with the help of the app, the period tracking app, it makes a very good, it gives you a very good, pattern that you can follow.
Okay.
Yeah.
Also, the pills do not affect how your fertility and your reproductive system.
No,
it's
they
just
do not.
The weight, the acne.
Yeah, with every contraception method, there are side effects which you might experience. Yes. And also very important to note, no contraception method is 100% effective. You might still be on the pill and conceive. You could be on the coil and conceive. Yes. You might be on the depot injection and still conceive. We like to say that they have like a 98 or 99% success rate.
Yes.
But still we have cases where people conceive while on contraception. Yes. But yeah, pills are totally safe and convenient, but some have been known to cause clots, like Yasmin. Okay. Yeah. So some of them, if you know that you're likely to get clots, then you're not supposed to take the everyday pill, and you should try for a non-hormonal method. Okay. Yeah. Which brings us to our second categorization of contraception, the non-hormonal methods for women, which include the condom, the male and female condoms, they are female condoms, the diaphragm. The diaphragm is a device which you insert in the cervix to prevent semen from reaching the uterus, the egg, yeah,
Okay.
the diaphragm,
Yes.
and also the IUD, the intrauterine device,
Yes.
yeah, or the coil, yeah. The coil is a non-hormonal method. It's a T-shaped device which is made of copper.
Yes.
Copper is anti-spermicide, is spermicidal, meaning it kills
The
sperms. Yeah,
yeah.
it's also very safe. No side effects. No
Completely-
hormonal side effects.
Okay, no
hormonal
hormonal
side effects
okay.
like acne, gaining weight,
Yes.
loss of libido, mood swings.
Yes.
Yeah, no such effects. The only effect you might experience is for the first 3 to 6 months of insertion.
Yes.
Your menses might be a little heavier than normal, and you might experience some cramping around the lower abdomen area.
Okay.
But that's perfectly fine, because after some time that will end. Yeah.
Okay.
Yeah. And also the other effect you might experience, which is not a side effect on the woman, is that your partner might actually feel the strings during intercourse.
Okay.
Yeah. Because it's usually inserted, it has strings,
Yes.
which when it's being removed will be pulled to remove the device. Yeah. So these strings are actually left hanging in the cervix. So if your partner is well endowed,
Yes.
and his penis reaches all the way to the cervix,
Yes.
he might actually feel a prick
Okay.
while having sex. Yeah, so as a result, the strings are usually cut up until the very end, so that your partner does not feel them during intercourse.
Okay.
Yeah.
So, like, let's say he's well endowed and the strings, maybe they were left a little bit longer. Can having vigorous sex, like, push it?
Oh yeah, vigorous sex will not push the strings, but it might displace the IUD from its position. And that's how you can get pregnant while still on an IUD, because if you put in an impossible position, and then the thrusting is probably too rigorous, it might actually displace it from where it's supposed to be. And therefore it means you're at risk of getting pregnant, because it's not where it's supposed to be.
Oh, so having the coil, you have to check on the, the position you're in while having sex? Or
Yeah,
it's just
yeah,
how vigorous you guys will be?
yeah. If you're too vigorous, or if you're in a position that will put a lot
What
of pressure.
position? Tell us the position.
I've had a patient who had who conceived while on an IUD because she had sex in a car.
Oh.
So yeah, she was generous enough to give me the details. And yeah, and it was how do you explain it? But yeah, it was a position that led to the displacement of the IUD from its natural position.
Okay.
Yeah, so she conceived.
So some sex position you'll have to, cut them when you're on the IUD.
Yeah, you might have. Yeah, you might have.
Give us an example. Let us learn before
An
we
example,
get babies with the IUDs in there.
Okay.
Don't
let me
filter,
think.
just say it. We are here to be
Well,
educated.
Yeah, I think a position that puts some strain on the pelvis area, yeah, or maybe a position where the woman has to Santa Kombia position gani mresh. Nakwambia gani.
There are several positions. You know, as
Okay,
a
you can
man,
tell me. You can tell me which ones you know, and then we can work with that.
Okay. There's the missionary. There's
Yeah,
the
missionary is safe.
Okay.
Yeah.
There's the
Doggy is safe.
The reverse
Cowgirl is safe, both reverse and normal.
Okay.
Uh-huh.
Okay, those are.
Yeah, those ones are okay.
Kuna zingine
Are those the only ones you know?
I want to be educated. You want me to mention all of them?
Well, yeah. You can just stick to the basics.
Okay, so
Stick to the basics.
so contraception makes the sex
no,
life become boring.
That specific method
Yes.
will you run the risk. Yeah,
Okay.
but it's not for everybody. You see, also there are women with very short services.
Yes.
Services is plural for cervix. Services. Yeah.
Yes.
They're very short, and therefore, yeah, if you fold them up in a certain position, you might actually displace the IUD. And if you fold them in that position and thrust really hard,
Yes.
the coil moves. And that's why, while on the coil, you're advised to go for checkup every 3 months to see if it's still in position. And also, by the way, menses could even make the position shift. If you're having very heavy menses, because menses usually is your uterus shedding its outer wall, as it's shedding the wall, the position of the IUD might shift. So it's not just sex that might cause it to shift, but also very heavy menses. So if you know you're on the IUD, just to play it safe, you should go for checkups every 3 months to see if it's still in position, and you should have an ultrasound done every 6 months. If you're on the coil, just to see if the position is okay.
And if there are ladies who say like having the IUD inserted for the first time, it's really, really painful. If the pain, how long does the pain take to go away? Like after the insertion?
Usually a day or 2. And that's why we advise them to get it done while they are on the lighter days of their menses, when the cervix is still open. So you should go on the 3rd or 4th day of your period, of your menses, when the cervix is still slightly open, on the days that you're spotting. That's when you should have it done, as opposed to when you're not menstruating, because now we will have to open the cervix, which is painful, and insert it. So just have it done when you're finishing your menses. You might experience some cramping because it's a foreign object inside there. And but generally the pain should not last for more than a week.
Now, the insertion, you've explained it, how it will favor someone who is on their menses. So there's ladies who have given birth, you know, like it takes time before they have their menses, depending on the person herself. So if you want to get it before you have your menses, so that is actually not good to do it. Like it will become extra painful, or should you wait for the menses?
After you're pregnant, after you've delivered?
Yes, after delivery.
After delivery, it's actually the best time is after you've given birth.
Immediately?
Like immediately the baby has been born, because the cervix is still open, the coil is inserted, and that's it.
Just like a...
That's the best time.
Even if you...
If you've decided it's the coil that you want, after the baby, and you don't want any hormonal method, then because after the baby and the placenta zimetolewa, your cervix is still open, then inaweza ekwa. That's perfectly fine.
So that it includes both ways of delivery, you know, like the CS
or cesarean
and the
unaweza ekwa na cesarean bado after delivery.
So what other effect comes with having the IUD?
The IUD, like negative side effects, Ama?
Yes, we know, like we want it there because we don't want to get pregnant. So the negative part of...
apart from now the heavy bleeding, the occasional cramping, generally it's a very like safe method. I would actually like advise, it's what I'd advise, because these other methods might lead to other things. Might lead to tumors. There are tumors which grow on the influence of hormonal contraceptives. Libido goes down.
With the hormonal contraception.
Yes. You experience drying up. There's actually a research that was done about how attractive you find your partner while you're on contraceptives, on hormonal contraceptives, versus while you're not on contraceptives. So you tend to desire your partner more when you're not on any contraceptives. Because contraceptives are hormonal. They change your hormones, they change your libido, they change so many things, and you actually lose a degree of the desire for sex. You know, sex is like most enjoyable when it's risky. It's most enjoyable, and risky meaning it's most enjoyable when it's likely to cause a pregnancy. That's when sex is like most pleasurable. When it's risky. So when you're on hormonal contraceptives which have changed your hormone profile, they've changed your libido, then it loses that element of riskiness and therefore pleasure.
Okay.
Yeah. So I'm not a proponent of like hormonal contraceptives. I'm not, unless now the patient really wants a specific method.
Yes.
Then I mean, you just have to do it. But now you advise them accordingly.
Yes.
Yeah.
And still on the IUD, the question on does you have because when you ask about it, you have to take it out like a year or a year and a half before you want to conceive again. And some people say like after taking it out, it takes longer than the year or a year.
Not the IUD. The IUD is non-hormonal, so meaning it does not delay your fertility. Yeah.
Okay.
So you can have it removed today and get pregnant today.
Oh, so the year and a year and a half to wait.
That's the implant.
Oh, it's for the implant.
The implant, because it's hormonal.
Yes.
So that one, fertility will take a while to rebound, to come back. So if you want to get pregnant and you're on the implant, which there's Jadel and Implanon, there's one for 3 years and one for 5 years.
Yes.
So if you want to get pregnant, you can remove it and wait. There are women that even wait for 6 months before they can get pregnant again. Yeah, but usually it's 3 to 6 weeks. But for some people, it takes even longer. Yeah, so the implant, because it's hormonal, it delays your fertility. Yeah, but the coil does not. The coil is actually used as an emergency contraceptive. Like if you've had intercourse and you're not safe, you can have a coil put the following day, just like P2, within 3 days, and you won't get pregnant. It can also be used as an emergency contraception.
Okay.
The Mirena is a coil which has progesterone.
Yes.
Yeah. I said that the coil is non-hormonal, but the Mirena is a hormonal coil, but it's a hormone that will only act in the uterus. It won't affect the rest of your body. Yeah. So the Mirena will have progesterone, which is a really good hormone because it makes the uterus wall very thin. So when you're on the Mirena, you have very light menses, very light, like 1 day, 2 days max, and you finished rolling. Yeah. So a lot of people prefer the Mirena. Of course, it's more expensive than the other one. But now the copper is the one that goes for 10 years.
Okay.
Yeah. Yeah, 10 years meaning after 10 years, now you run the risk of getting pregnant if you still continue with the same coil. Yeah. So after 10 years, you can have it removed and put another one.
Just like done for the 5 years. After 5 years, you get another one.
Yeah, but those are IUDs. I'm not talking about the implants, the one that you put on the arm. Yeah.
Okay. So what other form of contraception is non-hormonal apart from the IUD?
Non-hormonal, we have just condoms and IUDs, and also now the natural methods, which involve counting your days.
Safe days.
Yeah, safe days. If you have a very regular cycle, if you know that my cycle is 28 days, we have apps on the phone which actually do an amazing job of tracking the cycle. They tell you when you're ovulating, when you have the low chances of conceiving. Yeah.
But does it really
work? As a doctor also, I cannot say for sure that these are methods that you should follow, because I'm a scientist and I go by data which has been tried and tested. But if a female has a 28-day cycle, you're pretty sure that she ovulates on the 14th day. Yeah. But because you're also not pretty sure, you refrain from sex like 5 days before the 14th day and 5 days after. So those are 10 days where she runs the risk of getting pregnant. So during those 10 days, you can use a condom or you can abstain completely. Yeah. But the other days, she's not very likely to get pregnant. So so if you don't wish for your woman to be on contraceptives, then you can try that method. But I'll just say, this is a disclaimer. I did not say that you should fully trust the safe days, because some women have actually conceived on their menses. You have like very fertile women who even release 2 eggs in a month. One on day 14 and one on day 28 when they are actually about to start menstruating. And you might think that she's very safe because she's about to start menstruating. But she's still ovulating. Yeah, some women, they have like 1%, yeah,
Yes.
but they're there. So that's why you cannot fully trust safe days. Yeah.
Yes, and
Yeah.
also the fact that the sperm can live for it's 5 days, up to 5 days.
Yeah, 3 to 5 days, depending on the pH of the vagina.
Yes.
Yeah, so you cannot fully trust safe days, but yeah, but you can. But they've been used in the past as natural methods, and obviously they were not quite successful because our grandfathers had 10 kids each. So yeah,
Yeah.
they're not very successful.
Yeah.
Withdrawal is another natural method, which if your pull-out game is strong enough, you might actually experiment.
Yes.
But also I'm not here to like say that it's a tried and tested method.
Yes.
But a lot of people use it and they say it's okay. So to each their own. But as a doctor, it's not a foolproof method of contraception.
Yes.
Yeah.
On the pull-out method, there's the pre-cum.
Yeah, pre-cum. Yeah.
Okay, so that can bring about the risk
No.
of getting pregnant.
No, pre-cum,
Yeah.
there's a difference. There's pre-cum
Yes.
and there's cum.
Yes.
Pre-cum is a clear, colorless liquid that is produced when a man is aroused.
Yes.
And that one does not contain spermatozoa, does not have the sperms which are responsible for pregnancy.
Okay.
So you cannot get pregnant from pre-cum.
Okay.
But a lot of times you can actually produce cum, like semen,
Yes.
before you actually ejaculate,
Okay.
which can get a woman pregnant. Yeah. So it's important to note that while pre-cum cannot get a woman pregnant, yeah, you can still produce a small amount of ejaculate
Yes.
even just before you climax as a man, which can get a woman pregnant. Yeah.
Okay.
So pulling out is also, for that reason, it's also not foolproof because you might actually get someone pregnant while that was not your intention. Yeah, but for some people it works, and it's if it works, it's hard to dispute.
It's all about your pull-out game.
Yeah, it's all about your pull-out game if it's strong enough.
Yeah.
Yeah, there are people who are very considerate. They don't like their women taking contraceptives, and they actually prefer pulling out.
Yes.
There are women who like their men not pulling out. I don't know why. Mbona mpendi.
I think it's just human, and the thrill of having such the risk happening. Okay, so still on the pull-out. So you said it's quite safe.
Yeah.
Yeah, if your pull-out game is strong. So if my man has been pulling out for 3 years, 5 years, 10 years, ni pull-out game iko strong, ama we should go get checked, both of us, ama yeye?
Yeah, that's a bit suspicious. Kama amekuwa akipull out for 5 years and you're still not pregnant, it could mean one of two things. It could mean he's an expert at pulling out. Yeah. As in hakuna hata like that one chance yenye mess. But also it could mean he might be infertile. Yeah. And that now calls for further analysis. He can go for a sperm count.
Yes.
Where he produces a sample of semen and it's analyzed kuangalia kama iko sawa, kama inaweza impregnate, kama the sperms, the morphology of the sperms,
Yes.
as iko sawa. You might be having the right number of sperms, but the morphology, the way they look, is not right.
Okay.
They don't have the tail.
Okay.
Yeah, so as easy swim, as easy they cannot move towards the egg. Yeah.
Okay.
Yeah. So those sperms cannot get a woman pregnant. Yeah. You can be having okay sperms, like morphologically ziko sawa, but they're not enough.
Okay.
Yeah. So that can also not get a woman pregnant. So as a man, if you're having trouble like conceiving and probably your wife is okay, then you might want to consider getting a sperm analysis done.
Okay.
Don't ask how they get the sample at the hospital.
I want to know.
You want to know?
Yes, I want to know.
Well, some nurses are kind enough to like help you out.
Ooh, how? Please.
Yeah.
How are they helping out?
They just help out. Yeah, they help out. Actually, kuna like some hospitals where the nurses like they give you a hand job and then they get the sperm sample.
Okay, so ladies, please, let's take our men for the sperm counts.
But some people actually just like you're given a dish, a petri dish,
Yes.
and then you can get the sample with your wife at home, and then you
You
take
take
the sample to hospital.
Okay. Wow.
Yeah.
Nurses. I see.
Yeah. Or you can do it yourself in hospital. You're given like a room,
Yes.
given like a magazine or a phone or whatever, and then you get the sample yourself. So yeah, it's a question that's not normally asked, but thanks for asking.
Now they know.
Yeah.
Mtakuwa mnapata women flocking huko wakipeleka their husbands and boyfriends.
Yeah.
Okay, so moving to the male forms of contraception. Yes, we know most men just use, the condom. Then there's the vasectomy that,
Yeah.
it's a demon to all men.
Yeah.
Yes, please, Andrew. Like
Yeah.
you can get
Okay.
a brief, intro
Yeah,
to the
medically,
condoms.
yeah. So male contraceptives are the condom, the male condom,
Yes.
and now vasectomy, which is a permanent method of contraception, because it entails the cutting off the seminiferous tubules, which transport the sperm to the rest of the ejaculate. You see,
Yes.
a man's cum is not just sperms, it's mixed with other fluids from other places.
Okay.
You have fluid from the prostate, you have fluid from the testes, you have fluid from the seminiferous tubules.
Yes.
They all combine and now they produce the ejaculate.
Okay.
Yeah. So if you get a vasectomy, you're still going to be ejaculating. Yeah. But that ejaculate will not have sperms because
Yes.
the tube that is now supposed to bring the sperms to
Yes.
the ejaculate has been cut off.
Okay.
Yeah. So you'll still be coming as usual and
Yes.
everything, but it's just that the cum will not have sperms. So it cannot impregnate a woman.
Yes. Like
Yeah.
everything will be normal.
Everything will be normal.
Yes.
It does not affect your testosterone levels.
Yes.
You'll still maintain the ability to have an erection.
Okay.
But the only thing that your semen is going to lack is
The sperm.
spermatozoa, the sperms.
Yeah.
Yeah.
So having a vasectomy is not reversible.
There are those that actually can. I've read that there's a way you can like clip them, just
Okay.
clipping them and then unclip them later.
Okay.
But for a very long time, it has been deemed irreversible. So if you have a vasectomy, it's usually like it's done. Yeah,
Okay.
it's done, and yeah. So medically speaking, it's a foolproof method of contraception. The man cannot impregnate ever again.
Okay. Oh, so that is like the tube tying in the
Yeah,
females.
yes, tubal ligation.
Yes.
Yeah, the tube tying in females. Yeah, or even like chopping them off completely in females.
Okay.
Yeah, or even removing the uterus completely
extreme.
in women. Yeah, that's extreme. Yeah, that's extreme.
Yes.
And, but usually it's done on females that do not desire to give birth again. If you've given birth to like 4 or 5 kids and you feel like that's the limit,
Yes.
yeah, you can consider it. It's also an option.
So when it comes to vasectomy, you can now choose like if you want it to be like the permanent one or just get the.
Yeah. Although I've not like, to be honest, I've not heard of like in Kenya. I've not heard of the semi-permanent way.
Okay.
Yeah, mostly it's just like if it's a vasectomy, it's usually permanent.
Okay.
Yeah, so it's probably a tough decision to make as a man.
Yes.
Because you understand that from this point onwards, I'm not going to be able to get a woman pregnant again.
Yes.
But if it's a bullet you're willing to take, then that's still okay.
You're
Yeah.
scaring them. We need them to do the vasectomy. Easy bit
why?
naming. We deal with the pregnancy, the menses, then there's the hormones that come with, getting the
Yeah.
hormonal pill forms
Yeah.
of contraception.
Yeah.
What is one burden?
Yeah.
Yeah, they should go for yes. I'll be biased. They should go for the vasectomy.
No,
We are
no way,
tired.
no way.
We are tired.
We want men to retain the ability to impregnate.
But okay, we are married. We are not planning to have any more kids. Why do you want to impregnate?
I mean, it will make you respect me more. Just knowing that I can impregnate.
Please.
Just knowing that I can even do it outside.
No.
Yeah, because you see, like, nature never intended for the man to lose his ability to impregnate. while a woman loses the ability to get pregnant,
Yes.
the man should never lose the ability to impregnate ever.
Yes.
And that is part of what has ensured the continuous survival of our species throughout the years. Because you see that for the longest time, men used to be polygamous, and that was perfectly fine.
Yes.
Even a lot of cultures and some religions like Islam allow for a man to have multiple wives, which is perfectly fine. So I feel like it would be doing your ancestors a big injustice.
Oh, no, please.
Because they fought the wars, they braved the very hard times just so that you could be born, and then you're born and you cut your nuts off. Imagine, and you cut your nuts off.
You're not cutting your nuts off. It's
But
just like a small
you're
cut.
losing the ability to impregnate.
No,
Yeah?
so that is Ndwiga the man speaking, not Ndwiga the doctor.
Yeah, obviously, as a doctor, ni sawa. But as a man, hapana, it's not a method I'd recommend. Like, I mean, you should always remain virulent. You should always stay toxic. You know?
Let's tell. Ndwiga Samana.
But anyway, I'm joking. If it's a method you have agreed with your wife,
Yes.
you've decided the vasectomy, and you've decided that as a man, I have no need to like get people pregnant again. But even psychologically, you see, like, ukipata vasectomy as a man, it kind of kills your esteem kidogo.
Vile mnasema you're shooting blanks.
Yeah, you're shooting blanks. Like, itakuwa tu at the back of your mind, it's not something you can forget. You see?
Yes.
But that's just my personal opinion. It's not a medical opinion. As a doctor, you can do whatever you want.
But see, recently it has been known that young men are actually getting the vasectomies.
Oh, yeah.
Like, the
I've read
number has
reports.
quite
Yeah, has increased, yeah. Yeah, that comes now to like, I don't know, I think just the same way kuna LGBT on the rise.
Yes.
I think there's a lot of brainwashing that is happening to our men. I think now more than ever we need strong men to stand up for men and for women also. I believe where men are strong and they work hard, they provide and protect for their women.
Yes.
I believe the women are even happier.
True.
Yeah, they're even happier. So I do not think that as a man, as a young man especially, it's wise for you to get a vasectomy. Just like as a young woman,
Yes.
it's wise for you to have your tubes tied and you've not like given birth enough. Yeah, because you might change your mind later. Yeah, plus we need you to like reproduce and procreate, which is why we are here on earth. And after we are dead, it's our kids that will succeed us.
Yes.
So yeah, it's you might want to look into the temporary methods and not the permanent methods, especially when you're young.
Yes.
Yeah.
Yeah, that is very true. Yes. And as you've heard, as long as you're sexually active, please get a method of contraception that suits you, suits your body. Go to a doctor. Dr. Ndwiga is here. The number again is in the description box, and you've seen him. He's very friendly. So sidhani mnaweza shindwa kuuliza swali. And men, please, again, I'll be biased. Vasectomy does not kill your libido. Haiharibu performance. So save us kidogo. Tuache kukula mapills huku nje. Yes. Thank you very much for this episode.
You're
It's
welcome.
been a wonderful series. Yes. Because, like, sex is happening out here. So practice safe sex. Get contraception, get help, get advice from your doctors, from your gynas. Thank you very much for taking your time to watch our sex, female health, and contraception series. Thank you and bye.